Hi everyone. Hey everyone, it's Dr. Chugh from the Toronto Concussion Clinic, and in a previous video we showed you how to become more aware of your center of gravity versus your base of support. And then we got you to become aware of the relationship between the center, like where the center of gravity is in space and where your limits of the base of support is and how that feels. And we introduced to you the idea that you can control the center of gravity using different strategies. You can control it, you can influence where it is relative to your base of support, which is the area kind of drawn around your feet. You can influence it by just how you pitch your ankles forward or backwards, your knees kind of forward or backwards, that's your ankles, your hips, how you move your hips, and how your shoulder blades are positioned and your neck is positioned, and so on. So now that you've become more aware of that relationship between your center of gravity and your base of support, and how it feels when you're kind of at the limits of your base of support, now we're going to teach you how to use your muscles to bring that center of gravity back in the middle of your base of support. We call it homing in on center. Okay? So when you're homing in, you're going to find the most efficient way to do that is to use your hips. And if you look at children and little babies trying to pick up their toys, they're going to kind of always bend from their hips. They never kind of do this kind of like back thing where they're like that, right? So we're going to, it's kind of encoded in you already, but many of us have kind of lost that habit of using our hips a lot. So it's a simple thing, and you just kind of, just the hips. Everything else kind of stays the same. Some people, what we notice is when they bring their hips out, they kind of want to also arch their back. And when they bring their hips forward, they also kind of want to tuck in their tail, so to speak, right? We don't want that. We just want you, unless of course, that's useful and a rehab person will show you, depends on how your pelvis is aligned. But generally I want you to learn how each one of these movements can influence that center of gravity. The center of gravity is like a bowling ball in your pelvis over here. You can think of it like that. So when you're in your base of support, when you're at your limits of your base of support, how are you going to effectively bring your balance back under your control? So from here, if I'm way at the limits of my base of support, I gotta take a lot of effort to crank with my ankles. With my knees, I'm still kind of off center and I'm rounding on my back. But if you look at my base of support, the limit of my base of support over here, I'm just bringing my hips back. And I'm now really stable. And I feel very grounded. So that's called the hip strategy, and I want to introduce that to you guys and see if you can practice. Sometimes people find it difficult. In a way that you can find it a bit easier is you can get a strap. And if you don't have an anchor point at home, you can get someone to help you. Just wrap it around them, and you just kind of practice stretching into it, like that, to get that feeling going. Or you could do it with a stability ball, just to learn to unlock those hips and get them moving, and use that strategy to home in back on center when your balance feels a bit compromised. So that's the hip hinge strategy. It's probably the most effective one we use because it's close to your center of gravity. It's very powerful, and we'll talk in future sessions about how then to use that new strategy to ground yourself in the face of many other things that can throw you off, like busy visual patterns or spinning lights or things like that. So I hope that was helpful for you, and I hope you give it a go and learn to kind of unlock your hips and in a way where you can home back on center and keep your center of gravity squarely within your base of support. And you can practice that in different contexts, like we've shown you before. You can practice it in narrower stance, on basu balls, and so on. You can practice it just like I showed you previously, but now using this new skill. So I hope that was helpful, and stay tuned for future videos where we help you on your road to recovery. Take care.